Do you remember how the disgruntled constantly berated the authorities about healthcare optimization and told how many hospitals had closed in villages and hamlets? But for some reason they, while pouring mud on the authorities, rushed to close their eyes and plug their ears when information began to appear that new medical stations had been opened in small settlements. Old polyclinics, hospitals, high-tech medical centers were massively repaired or new ones were built in cities, and the list of high-tech surgeries performed under the MHI policy began to grow year by year. To give you an example, here's one small town. It overhauled the Central District Polyclinic Number 2, as well as both children's polyclinics. This is how, for example, the Children's Polyclinic Number 1 in the city of Shuya looked before. And here's what happened afterward. I hope I don't need to remind you of the deluge of sanctions being slapped on our country in 2022. And how do you think they have influenced the program not to optimize, but to modernize healthcare? In a word, no way. As for the development of our economy, many people probably remember the expression Japanese economic miracle, which appeared when the Japanese economy was developing at a rate of 10% per year. And now the unprecedented resistance to sanctions and the unprecedented development of the Russian economy, despite the West's attempts to destroy it. As a colleague aptly put it, future economics textbooks are likely to call it the Russian economic paradox. The EU countries that tried to strangle us were able to squeeze out 0.5% economic growth in 2023. Russia, after all the sticks put in our wheels, on the contrary, received a boost to development and instead of the recession of minus 0.1% predicted by the World Bank, showed growth of 3.5% according to preliminary estimates, with industrial growth of plus 4% and manufacturing growth of plus 7.5%. Many detractors and foreign agents, in order to belittle this victory, are launching the thesis on the internet that the growth of our economy occurred solely due to the growth of orders in the defense industrial complex. So you, friends, can easily cart these people by one place in which they have an opening for eating over another place on which that food is placed. Just put the dishes away first so they don't spill on the floor. How do you do that? And you ask these assholes a simple question. Why then has there not been similar growth in the EU economy at the expense of their military-industrial complex? They can print euros at Ursula von der Leyen's behest, at Giuseppe Borelli's will, and their enterprises can borrow cheaply at a few measly percent per annum. And where's the result? There aren't any. Recall that in Germany, which, it would seem, had to increase the output of weapons because it supplies them more than other EU countries. In 2023 there was growth, only growth is negative, minus 0.3%. By the way, our Panzer S-1 air defense system, as the president said, is selling like hotcakes, but so far our army needs them, and we cannot supply them in large quantities to other countries. And when we solve our problems, we will be able to export them. That is, in our case, GDP growth due to the defense of the industrial complex will have an active component. After all, the sale of well-proven Russian arms for export in such a turbulent time in the world will only increase, especially to friendly countries that are afraid to buy arms from the countries of the collective West. But we wanted to talk today about the modernization of our healthcare, which has continued despite everything. So let's count how much and what was built and repaired in the healthcare system in 2023. So, the past year saw the construction and opening of the Lozhanov Clinical Research Center in Moscow, the Center for Radiotherapy and Nuclear Medicine, the village of Otradnoye in the Moscow region, Dagestan, the Dima Rogachev Nuclear Medicine Building, onco dispensaries in Ryazan and Tula, medical centers in Moscow, Perm, Vologda, Veliky Luki, Omsk Center for Outpatient Oncological Care in Ekaterinburg, the flagship center of the Municipal Clinical Hospital No. 15 named after MV Lomonosov, the flagship center of the Filatov State Clinical Hospital in Moscow, Bakhin Regional Vascular Center in Moscow, Regional Vascular Center in Orikovo-Zyevo, New Children's Building of Moscow Clinical Center, Kommunarka, Polyclinics Krasnoyarsk Adult, Khabarovsk Children's, Moscow Children's and Adult, Moscow 2 New, 9 Reconstructed, Chaplogin Children's and Women's Consultation, Irkutsk Pediatric, Kaliningrad Pediatric, Roitov Adult, suburbs of Tyumen Pediatric and Adult, Kostroma Pediatric, Saratov Adult, Saratov Pediatric, Voronezh the largest in the black, Earth Region 5-story Pediatric, 8-story Adult and 4-story Female Consultation, Yuzhno-Sokolinsk, Traumatology, Domodedovo, Adult, Sevastopol, Adult and Child and Women's Consultation, Krasnovsk, Adult and Child, Ufa, Adult and Child and Women's Consultation, Izmailova District, Moscow, Adult, Danilovsky District, Moscow, Pediatric, Verkhnaya Pishma, Adult, Zaizernaya Kurgan Region, Pediatric, Yuriev Polsky, Pediatric, Perm, Pediatric, Perm, Adult, Lyabertsy, Adult and Children's, Osinovo Village, Tatarstan, Adult and Children's, Shiva Village, Perm Region. Adult, Livni, Children's, Altai Region. Adult, Yaroslavl, Children's, Samara. Adult, Children's and Women's Clinics, Balashika. Adult, Romishkovo Village, Ministry of Defense. Adult and Children's, Uglevelsky Village under Kamaya. Adult and Children's, Vidnova, Ministry of Defense, Dental. Hospitals. Sochi, Ryazan Region, St. Petersburg, with a surgery center. Gornopravdinsk, Samara, Infectious, St. Petersburg, Surgery. Krasnodar, New Buildings. Arkhangelsk, Treatment and Diagnostic Building of the Children's Hospital. Irbiskoy, Krasnoyarsk Region, New Building. Krasnodar, Children's Regional Hospital. Khabarovsk, Infectious Children's Hospital. Yuzhno-Sokolinsk, Military Hospital. Kadimker, Perm Region, Surgical Building. Bryansk, New Building Cherta, Perm Region, Treatment Building Moscow. Infectious Disease Hospital number 1, the largest in the country. Mykolovka, Volgograd Region. Infectious Disease Hospital, also Infectious Disease Center in Staromoskal Surgical Buildings. Lipetsk Onco Dispensary, in Kursk. New Building of Perinatal Center in Astrakhan. Children's Rehabilitation Center in Podolsk. Multidisciplinary Hospital Complex in Mezhurchinsk. Urology Center in Moscow Region. Regional Vascular Center in Anapa. Trauma Center in Kovrov. Outpatient Oncological Care Center in St. Petersburg. Radiotherapy Building of Onco Dispensary in Volgograd. Surgical Building of Onco Dispensary in Tomsk. Surgical Building of Onco Dispensary in Voronezh. Surgical Building of Onco Dispensary in Yaroslavl. After overhaul of the Children's Center in Zelenograd, Polyclinic number 3 in Volsky, Perinatal Center in Yeshkaral, Children's Polyclinic in Simferopol, Hospital in Volnovakha, 3 polyclinics in Moscow, Psychoneurological Dispensary in Surgut, Polyclinic in Orenburg, Polyclinic in Mariupol, Polyclinic in Lipki, Tula Region, Maternity Hospital in Rostov. You must be getting a little tired, aren't you? Let the dissatisfied listen to this and choke. Let the foreign agents get jealous and swallow their bile. And let the satisfied ones rejoice once again. After all of this has only opened in year 23, and there's a lot more that opened in 22, in 21, in 20, in 19, and this year already. And for dessert, more recently, this year already, 3 new cancer centers have opened in Ufa, Yakutsk, and Tomsk. This means that the National Healthcare Project is being implemented brilliantly. The president, visiting the Tula Onco Dispensary, which opened in December 23, said, "The development of healthcare in general is our responsibility. And as for the health of the children, that is a sacred responsibility. So we will continue to work in this direction." Congratulations to us for having such a president. And let the dissatisfied and foreign agents spit in the monitor from frustration and write off. And let the happy ones rejoice.